Now, the Vaccine Taskforce was set up to identify and buy vaccines. Can you explain exactly what your job is now, having done that? Why does it seem like you're going to be here, perhaps even in perpetuity?
Let's hope not perpetuity. But it was set up, as you say, to procure vaccines, which we did last year. And then I have to say, I took over from Kate Bingham, who did a tremendous job, and thought, well, I'm just going to help soft land all the vaccines now, get them there ready for the public to have in their arms. And then these variants started emerging. And although they're not dangerous at the moment, they are a threat. They're an emerging threat. And therefore, I was asked to work with the task force again and re-energize it to look to see how we treat those variants. And there's plenty of scope to do that. So it's nothing to be alarmed about, but it means that we need to be around a little bit longer and certainly get through the next winter and possibly a bit beyond.
So the Vaccines Task Force lives on trying to help identify ways of getting vaccines that tackle the new variants.
Yes, and I think we've always thought that this virus now is here to stay in some form, a bit like flu virus, but in a form then we just get to live with, and we don't think of it as so dangerous, and it doesn't kill people because we got vaccines for them. But that being said, we expect to move from being a task force to being normal business at some point, where it's just what the health system does. But we're not ready for that just yet.
Now, I think a lot of the country is wondering what to prepare for, what the landscape looks like. Do you think that we're still on course where for a rollout where every adult gets 2 doses of either Oxford AstraZeneca or Pfizer? Could you be in a situation of mixing and matching between the two, because you just started a trial to study that? Once people have had 2 vaccines, will there then be a booster this autumn or perhaps every autumn?
I think I'm not involved in the policy making about the vaccination. That's done by the government using the advice of what's called the JCVI. But the likelihood is, I would say, that we'll roll out this vaccine to most adults before we finish with the first round. And then we're currently studying whether to boost that response. So what we don't know about these vaccines at the moment, the ones that have been rolled out, is how long the immunity lasts for. Now, we won't know that until we've had the length of time to test it. So we have to be ready in case it doesn't last long enough to boost again. So if we need to, we'll be ready to boost as soon as we need to, maybe in the winter. And then on top of that, we know that the variant strains, the vaccines work against, but they work against better if there's a good immune response, a high level of antibody. So if we need to boost for that reason, we'll do it for that reason as well.
You're presumably studying all the data about the vaccines as it comes in, and it's a live global experiment, and this changes week by week. What can you tell us right now about the effectiveness of vaccines? Can we now say that infections are declining faster in the vaccinated compared to the unvaccinated for certain?
You can never say for certain until you've got all the data in, but all of the signs are incredibly encouraging. It's looking like these vaccines are doing exactly what we expect. Infection rates are going down, hospitalizations are going down, and people are remaining I wouldn't say virus-free, because we don't know that, but we know that they're not getting serious disease. And that's what we were trying to do. The important thing is, if you think about the flu vaccine doesn't stop everybody getting flu, but it stops it being a severe disease, and it stops people dying. You remember that flu has been a pandemic. It has killed people, and quite viciously killed a lot of people. So we've got over that one now. We work with the disease, and it's fine. We live with it, and the health systems deal with it. We'll want to do the same with this vaccine, with this virus.
Now, you've talked about effectively making a library of the sequencing of the virus. I was hoping you could just tell me a little bit about what that is, and the motivation for doing that is to speed up the production and approval of new vaccines that might tackle new variants. Does that mean that you could end up producing new vaccines that help tackle better new variants incredibly quickly?
Yes, that's the aim. So if you take flu as an example again, because we have a lot of learning from flu and we understand it, the manufacturers of flu have all of the various variants that come through each year. they have them in store. They store them in it's not a library because it's actually live virus. And then they go from there to making vaccines. The thing that's come through in the last year is how fantastic the mRNA technology is. So RNA is just a little piece of genetic code that codes for the protein that you want an immune response to. It's called messenger RNA because the body has got millions of them in the body all the time, making messages, making proteins that normally keep you alive and well. So all we do is we put that message in, it makes the spike protein from the virus. The body says, oh, I don't like this, makes an antibody, makes an immune response. What we can do is we can make whatever the changes to that spike protein that occur in the mutations and in the strain, the variants that come along, we can make all those and we can keep them, store them. We store those strains ready, those RNA vaccines ready. And as soon as we think there's one that might have broken through our vaccine armament, we can start a clinical study and we can get it into the clinic and then out into people's arms in a very fast time.
I think people are interested in just how fast you might be able to do some of this stuff. There are people in government who talk about the extraordinary achievement of this sequencing library, meaning that you could get a situation when you have a new variant and then you could have a new vaccine to tackle it and approved maybe as quickly as within 40 days. Does that sound about the timescale that you could end up producing new vaccines for new variants?
I think you could get to 40 days to having it tested in the clinic and know it works, and then you've got to manufacture it as well. So the manufacturing will take another period of time, but because you wouldn't manufacture huge amounts before you knew it worked, I wouldn't have thought. So it is a short period of time. It's not like waiting a year like we did this time for a new vaccine. We'd know it would work. We do a very small test a short test in the clinic, and then away we go.
So just to spell that out. So from the day one where a new variant comes along, you could have it tested and approved on day 40 and then manufactured and in people's arms a few weeks later.
I think 40 would be a real stretch, but we'd aim for something as good as that, but certainly within 60 days. And then after that, we would start the manufacturing, and that process takes a while, but depending on how many doses you're making.
Wow. So just within, I don't know, 10 weeks or less, you could have...
Well, certainly within 3 to 4 months, you would have a vaccine rather than what we currently had, which was 9 to 10 months or maybe even a year.
You've advance purchased, I think it's 350 million doses of the vaccine. And we've got the various companies, AstraZeneca, Pfizer, Moderna, delivering in a just-in-time supply line kind of way what they've promised. Are they delivering it at the moment broadly at the rate that they promised it? Do we expect that to continue from everything that you can see and everything that you're monitoring?
Yeah, so the thing that everybody needs to recognize is the manufacturing of vaccine is a very complex process, and predicting before you've made your first batch how quickly you'll make it and how many is really difficult. But I can say that at the moment we're very confident that the manufacturers are doing a brilliant job. They're delivering vaccine at the rate we require, and we will be able to vaccinate our population at the rate we require.
There were some worries, particularly from the devolved administrations, that might slow down a bit in the coming weeks. Are there any grounds from where you sit to be particularly concerned about that?
No, I think that might be logistics, that they want to vaccinate populations that haven't been vaccinated in that cohort in different places, so they're not pushing more vaccine out to areas that have already done that. So I think it's just logistics of where you put the vaccine. It's nothing to do with supply.
How much visibility in the future have you got? So can you be confident about supply at the rate that you were promised it, for the next 3 months, for instance, the next 6 months?
Definitely. We are confident within the Vaccine Taskforce now that the supply we're going to get will take us to the position where we can vaccinate as many people as the UK wants to vaccinate.
So the Vaccine Taskforce, that's an incredible achievement. So the Vaccine Taskforce knows that it can secure supply within roughly what time frame? Every adult 2 jabs of a coronavirus vaccine?
Well, I think we're probably talking August sort of time, August, September time, all done. Maybe sooner if we need to.
So how can you be so sure that all of the doses will come on time? Is that because they're all being manufactured in the United Kingdom, because the manufacturers tell you that the process is going well, and that that they have all the component parts? How can you, just forgive me for being curious, how can you be so confident?
We're confident because we took a portfolio approach. So the ones that are being rolled off the line at the moment, they're doing very well. Now, of course, they could have a manufacturing problem like you do with any manufacturing of anything, but with vaccines being more complicated, they could have a problem. But because we've taken a portfolio approach, we've got other vaccines that are going to be approved in the very near future. And once they're approved, we've got those as backup. So pretty confident that it's a very low risk that we wouldn't have vaccine.
And that sort of August, September, that's 2 doses, not just one for the whole adult population.
Yeah, we've got to deliver just over 100 million doses of vaccine, and I believe we should be able to do that. But I'm not in deployment, so I can't look at the numbers of when they will be. But if they need to be deployed by then, we've got the vaccine to do it.
Now, I've heard you say that you can deliver the doses so long as the government doesn't get particularly overexcited with its targets. I have to say, the government targets do seem rather conservative. I was at a vaccine centre just earlier today where they did cohorts 1 to 4 of the JCVI group by the end of January, and they're already on cohort 6, and they say that they could do cohorts 1 to 9, so everybody over 50, by the end of March, if you guys can supply the vaccine. Does that seem realistic? Could you get them the vaccine so that parts of the country could do all 1 to 9 by the end of March?
Well, it would be logistically, that'd be quite difficult because you'd have to be saying to other groups that can't do it quite that fast that you can't vaccinate the higher priority groups. So we have to do it evenly. And, I believe that the rate we're doing it at now everybody's got used to it now. It's a phenomenal number of people. It's phenomenal. We've already vaccinated more people than you vaccinate in a flu campaign in half the time. So it's phenomenal.
Simon Stevens of the NHS, I think, at the press conference yesterday, talked about doubling the rate from where we are today, but it can go higher than that, can't it?
I think that the thing that people have to recognise is if you keep pushing the system too hard, something might break and then you've got a problem. So I think the rate we're doing at the moment is getting us to the right place, and I don't think we should push it too hard. We should push it as hard as we can, along with the supply that we can push as hard. If we say to the manufacturers, double your output to us next week, they might push their system and it might break. So we've got to do it sensibly. I always say that, what we've done here is we've built something like we've built a Formula One car that can go 300 miles an hour. I wouldn't like to be the person that just sat in it and put the foot to the floor, because if it's never been tested before, it may not work or it may do something really horrible. So let's keep pushing. We'll keep pushing the numbers up. We'll keep pushing the numbers of vaccines that we get into the system up. We'll keep pushing the speed of vaccination up. But we shouldn't give people the expectation that this is something simple to do. It's very complicated, and we've done it amazingly well so far, and we'll keep doing it well, and we'll push as hard as we can.
What could a break look like? You said you could break the process. Just spell out what you mean by that.
Well, if you're trying to manufacture something and you try and increase the rate of it, maybe it goes one step too far and it stops working, and then you've got to start again. So you've got a break, So while something's working, don't mess with it. Don't try and push it too hard. It's the same with it. It's when you run a marathon. If you run at 5 mile, the first 5 miles too fast, you don't get to the end. You actually break down. And this is a system.
One doctor said today to me that he regarded the current phase as a sprint, and he was about to go into a marathon. And that marathon might last up to sort of 12 weeks or a bit more, which...
Yeah, might be right.
That takes us to about May for first doses for pretty much everybody, does it?
Probably, but the thing is, the Vaccine Taskforce was set up to deliver vaccines, not to deploy them. So it's definitely not it's well above my pay grade to talk in detail about deployment and timelines. I'm happy to say we're confident we can deliver the vaccines for that deployment, but it's really not my place, and nor have I got the detailed understanding of it.
Now, are the vaccines made from start to finish in the United Kingdom, or are there bits and pieces that we're reliant on from overseas? You'll know the political context for that question. At one stage, the European Union were threatening to introduce export blocks, and that threat might still be on the table. Can we do it all ourselves, or are we reliant either on components or manufacturing overseas still?
Well, I think there's not a single thing that's manufactured in any country in the world that doesn't involve supply chain that has things from other places, and that's just a fact. The majority and the bulk of what we make in the UK in terms of the vaccine itself and the fill and finish of it is in the UK. For the AstraZeneca vaccine, obviously the Pfizer vaccine is made in Germany.
That EU threat, at any point, were you worried by it, or were you worried at the time, and then the threat seems to have receded a bit? How did you view all of that export ban?
We were confident that what we'd ordered we'd get, and whether the threat, because it was at the political level, we had nothing to do with those discussions. We just carried on doing what we were asked to do, which was deliver vaccine.
I think the million-dollar question is, what did the Vaccine Taskforce do that ensured that our rate of supply is guaranteed in the way that you talk about so confidently, in a way that just hasn't been true with European countries currently struggling? What was it that you did to ensure that the UK got it right, where other countries are just that little bit behind?
I can tell you what we did. I don't know whether that was the reason it got us ahead. So we entered into this whole process back in March of last year, or May, I guess it was. We started really getting into it with the whole concept that we'd partner with the pharmaceutical companies and work with them to get the vaccines approved. So we established incredibly good clinical networks in the UK. We had the UK registry, which was the first ever registry for vaccine for volunteers, which got us to do trials quicker. We looked at manufacturing help and places where they could manufacture in the UK, and we worked with them in partnership, saying if you've got a block or a hole or a need, we can help you. I think that was the difference. That partnership became a real bond, and then they deliver for you because you're working together. And we didn't treat them as an outsider that you're just procuring vaccine from. We said, let's do it together, and let's make sure that we get vaccines not just for the UK, but help you get that development work through as fast as possible so that you can develop vaccines for the rest of the world. And that was part of our mantra.
That kind of high-tech manufacturing, was that something that Britain was already a specialist in, or have you had to build that capability from the ground up? Is this a novel process that you've constructed?
Certainly not from the ground up. The UK government had what was called a life science industrial strategy that's been going for quite some time now, looking at areas where high-tech manufacturing and high-tech science could be moved into products. And so a lot of the components were there. It was just a matter of then pulling them together and getting them to work together with a common cause.
Just a couple of other subjects. One of the roles of the Vaccine Taskforce is to help the international community. Do you think that there could ever be a situation where the UK's extraordinary pre-purchase, some of that stock, is sold on to other countries before everybody's had 2 vaccines? Or is that not the right way to look at it?
I think we've always felt that when we started, there were no vaccines. And so we took a portfolio approach. We wanted to make sure that there was at least enough vaccine to vaccinate the UK population. And at the point when we started, the view was maybe only 1 in 10 vaccine developments work. So we've got to get more than 1 or 2. So we got 8. And we've been incredibly successful. Some people say lucky that we chose 8 that look like they're all going to be approved eventually. And that means we've got far more vaccine than we need. There's no doubt that vaccine will be used, and it will be used for other citizens around the world. And we've just got to figure out a way of doing that.
But before we do both, or before every adult in the UK has 2 jabs, or is that a slightly specious argument?
We definitely want to vaccinate our own population, but it would be a bit weird to actually have people still dying and giving their vaccine away. So,
are there going to be better vaccines further down the track? Vaccines that deliver everything you want, sterilisation rather than partial infection reduction, and perhaps all in one jab. Is there even better coronavirus vaccine prospects?
There are prospects. There's nothing there that suddenly stands out, but there's no doubt that once we understand what these vaccines do in depth, we will make better vaccines that will do many of the things that you talk about here.
I just want to ask 2 questions about how we got here. What were the origins of the task force? The coronavirus response by the British government wasn't outstanding for a lot of 2020, and then this turned out to be the outstanding dimension of it. But its origins go back as early as April. Whose idea was it? How did it come into being? What role did Patrick Vallance, Boris Johnson, Dominic Cummings play in all of it?
I don't know anything about the roles of each of them play. I know it was a decision that Boris picked up the phone to Kate Bingham, because that's on record. But I think Sir Patrick was instrumental in thinking about needing a task force. We know that too. And I think the rest is history after that.
What judgment should be made on Kate Bingham's role as the founder chair of the Vaccines Taskforce? Do you think she was a bit hard done by the end?
Absolutely hard done by. She's a goddess. She is one of the most brilliant people I've ever worked with. She knew what to do. She made it happen. And of course, it took a huge team. The team inside that really made it happen is much more than an individual. But she led it with the most amazing energy and made it happen. And you can take nothing away from that.
One of the things I remember from last year was that whenever they stood up at the podium and in private, some scientists were far less sure that vaccines were the way out. There was talk about therapeutics being a large part of the answer. There was concern that vaccines might only work for some parts of the population and not others, and might be far less efficacious. Was that your experience early on? Did you have to fight some scientists who were a bit more casting a few more bits of doubt on the process? And what was the eureka moment when you realized, actually, yes, vaccines were going to be the way out because they were far more effective than people had realized?
There was never a debate. It was, we've got to get vaccines, and we just set about getting them. And as soon as we started seeing data, clinical data, it was looking good. And I would say when we got our first look at phase 1, phase 2 data with some of the vaccines, we realized they'd chosen the right antigen and the data looked good enough to actually produce something that was very effective. And then we had to do the big trials to prove it.
Has there been a moment where you've been able to deliver Boris Johnson good news and see up front the reaction?
Not me personally. I've had very little interaction with the Prime Minister. I've worked steadfastly behind the scenes, if you like. I've spoken to some of the ministers about the work we're doing. Of course, we get permission to spend the money through the ministers, so they make the decision. So we do speak to them, but not really. There wasn't really a moment of anything. It's all been good news, I would say, with the Vaccine Taskforce.
Finally, if you had a message, if you, having now sitting atop this extraordinary effort that I think it's fair to say millions of people are grateful for, what's your message to the nation who are benefiting from the work that you guys have done over the last year or so?
I think, first of all, thank you to all the volunteers that volunteered to go in the trials. They're the most important people in the end. Without them and without those trials, the rest of the public wouldn't have any vaccine. And just thank you for all the people involved, the clinicians, the clinical networks, the government, the people in government, the civil servants. Everybody worked flat out. We wanted to beat this virus, and there was a camaraderie there right across the nation. Everybody wanted it, and it was easy. It was sort of easy to work in that environment.